Living with sciatica is exhausting, not just physically, but mentally and emotionally. Hi, I'm Dr. Pavan Sabharwal, chiropractor and founder of the Mindful Spine Wellness Studio. Sciatica doesn't just affect your back or your legs, it affects your entire life. Your sleep suffers, your mood changes, work gets harder because it's tough to focus. You stop doing the things you love because you don't feel like yourself anymore. That's what you're really dealing with when you say, I have sciatica. For some of you, you've already tried different types of care. You may have felt a little relief, but it didn't last. For others, this is new. You've just been diagnosed and you're wondering, what does this mean for your future? Either way, it's normal to feel frustrated, unsure of what to trust. One of the most common things I hear is, I've tried treatment, but nothing changed.
Before I started seeing Dr. Pont, my sciatica was so bad I couldn't walk. I was laid up, I was on disability, I was laying on the floor for about a month. It was difficult for me to go upstairs. I had to plan an hour in advance, so I was gonna go to the washroom because it was gonna be an ordeal. Showers were difficult. So anything that involved me standing up straight was almost impossible. So I was in my 30s, and at that point I couldn't get my body into a vertical position. So before I started seeing Dr. P, the things I was doing most was I was doing physical therapy. That was helpful. I was also seeing my general practitioner. I think you'll find if you have a back injury or sciatica, the doctors, they're really good at pain, but they're not really good at recovery. So I did about 6 appointments where I was going from T3 to Oxy and moving up until eventually I was on this drug called naproxen, which numbs your nervous system. And then for them, that was a victory. It was they could suppress my nervous system to the point where I wasn't experiencing the pain, but I wasn't actually getting better. I was experiencing what they call foot drag. When I would try to walk, I would drag my left foot. So I was in a lot of concerns that I would fall. I would experience a fall down a staircase, things like that. Or honestly, I was just embarrassed at the fact I was not an old man, but I was feeling like an old man. I was feeling like I was an 80-year-old person, and people would have to get up on the bus to give me their seat because they could tell that my left leg was dragging. My first appointment, the thing that I immediately realized was he understood how to I guess my first thought about chiropractic was, everyone thinks just a bunch of he's gonna crack your back or adjust you and maybe somehow you'll feel better. But it's Dr. P's holistic approach. The first time he saw me, he realized that I couldn't rest. I couldn't get my body in a position where I could lay on my side and rest comfortably and sleep. So he basically got me on the floor at the time, put the pillows in certain positions, and that was probably the first time in 2 months I was able to lay down and not feel pain. And then for me, that was a wake-up call that, this person actually knows what they're talking about. It's not just about adjustments and all that, it's about treating the entire body and helping you heal.
So when you come into my studio, I slow everything down. I take the time to listen and understand your lifestyle and your unique experience. I explain what's happening in your body, the plan, and the piece that's often missing. Sciatica rarely improves if the habits irritating the nerve every single day stay the same. Look, most of us live on autopilot. The way you sit, work, move, sleep, and exercise all create repetitive strain without you even realizing it. If those patterns don't change, the nerve keeps getting irritated. That's where my approach is different. I take a deep dive into your daily life, your posture, your work setup, and your movement patterns. Alongside that, I use muscular rehabilitative techniques with precise chiropractic spinal realignment, helping your body reconnect with your nervous system. When we reduce the daily aggravators, your nervous system finally has the space to calm down. That's when many people notice relief coming faster and lasting longer.
When I had the injury, I was incredibly stressed. I wouldn't recover at all. And the idea that other people have gone through this and that Dr. B had a plan really put me at ease, knowing that there was a progression. And when he saw me, he said this is going well. We're ahead of schedule. You're going to be on your feet before you know it. You're this far away from maybe jogging again or playing hockey again. And that really puts you, you're in a very dark place when all that's been taken away from you, and knowing that there's a progression and that there's the light at the end of the tunnel, it's all the difference in the world. A lot of my problems stem from working at a desk. It was not just how long I was sitting, but how I was sitting, understanding the movements you're doing, and then just being intelligent about how you pick something up, how you lean, how you engage your core, how you engage the muscles properly to do the activities you want to do. When I first had this injury to my disc, I basically lost function in my left leg. It was possible that I might not walk again. It was definitely foreseeable that I would never play sports again. Now I can do all those things. I'm back to playing hockey. I'm back to golfing again. I'm running up to 10 miles. I can sit at work. I can stand at work. I can pick up heavy objects. I think when this first happened, that was inconceivable to me. If you're skeptical, I think the first thing I'd say is you have to understand that chiropractic care isn't just back cracking. I think that was my misconception, was that you see a chiropractor, they're going to do some adjustment and either fix you or it won't fix you. And then you realize that the approach is for the entire body. There's manual manipulation, there's decompression. There's a lot of things that could help you. Not everyone's the same, but it's not just a single thing. It's going to see someone, it's the therapies they're going to give you, and then the things you can do outside, the way they're going to train you how to carry yourself, how to carry objects, how to sit, how to be in the world and be aware of your body. That's going to help you the most.
The mindful part of the mindful spine is all about awareness and empowerment. When those habits change, healing finally has a clear path forward. If you're watching this and you feel stuck or unsure, if you're tired of temporary relief, the first step is booking the Mindful Spine Discovery Assessment and Treatment. You don't have to just manage sciatica, you can understand it, change the patterns around it, and move forward with confidence again.